Recently, my niece and I were watching a movie, and a particular scene popped up that did not leave her the same. And this was a scene of a hypertensive patient. And this person was in such a critical condition that she turned to me and asked me, "Auntie, what is high blood pressure and how does it develop? Can it be prevented? Can it be treated? Can it cure?" And so I have tried to put this in a simple diagram here. And this is our blood vessel. Our normal blood vessel is here. These are the walls of the blood vessel, which are elastic in nature, meaning they can expand and contract. So when your blood vessel starts accumulating some materials here, this could be fat deposits or any other material that get trapped as blood is moving along your blood vessels. Now, these materials, if they accumulate over time, they make your blood vessels smaller. And so blood is not able to flow freely as it should be. And so your heart is going to be forced to do a double work of pumping blood at a higher pressure than it usually does in order to supply blood to all parts of your body. And when you walk to the hospital and you tell them that, and they find out that you have hypertension, they're going to give you medications that are going to keep expanding this blood vessel, expanding it. And while these materials still remain unremoved from your blood vessels, so they keep accumulating. But like in physics, we know that every elastic material has an elastic limit, and so a time will come and it can no longer expand. That's when you hear this person has been diligently taking the medication, but we found them dead, right? And so hypertension is a lifestyle disease, and it can be modified or prevented or reversed at worst. The risk factors for hypertension are old age, obesity, consuming a diet which is full of salt or a high salt intake, and a sedentary lifestyle. Now, how can you reverse or modify these conditions or simply prevent high blood pressure? You can do so by developing an exercise program that is tailor-made for you and your body's needs. You can work on your meals or your dietary patterns and eat foods that are healthier and that are going to help you clear out these materials from your blood vessels so that blood can now start to flow normally in your blood vessels. Then you also want to watch your salt intake. And the last one, which I want to emphasize so much, is reducing on your stress or developing stress reduction techniques. Now, in my next videos, I'm going to be sharing with you 10 stress reduction tips or techniques that you can use and that you can do by yourself in order to reduce on that stress, which is a risk factor for high blood pressure. Remember, almost 1 in 4 people have high blood pressure or hypertension. And globally, it's about 1.28 billion people who have high blood pressure, and most of them do not actually know they have that condition, because these people manifesting this condition are actually from low income and middle income communities. So the best thing you can do for yourself is prevent this condition before it's too late. I will see you in my next video. Have a beautiful day.